Thank you so much for joining me today on the podcast. My name is Maria, and I am really passionate about learning from experts in the field of hair restoration. I am very happy to have you here to share your insights and your experiences. This is such an important topic for me, and I can't wait to dive into today's conversation with you.
Well, I'm very excited, Maria, to be chatting with you, specifically about hair loss. It's a topic that I live and breathe and talk about all day long.
Can you share a bit about your background and how you got into the hair restoration industry?
That's a loaded question. To make a long story short, I grew up in a home where my father's a facial plastic surgeon, so I was always surrounded by medicine and happened to also be surrounded by cosmetic, the cosmetic end of medicine, and so I was always driven to kind of combine my passion of taking care of people, aesthetics, and beauty, all kind of meshed into one. Um, and in terms of my training, you have to go to medical school. I did an internship. I did a fellowship in hair transplants, and I've spent many years training and working alongside my father, performing plastic surgery procedures. And so that's kind of how I ended up in hair. I find hair to be very interesting because it's one of the last frontiers that has kind of been untouched by the cosmetic world. A lot of focus has been on the face, the boobs, the liposuction, but hair loss specifically impacts everyone, and it seems to be an area that more and more dermatologists and hair surgeons are actively kind of trying to address because the demand to take care of hair loss is increasing.
A very interesting journey, which leads to a goal of helping people regain their confidence. And as you mentioned, it's an industry that has been growing a lot because people didn't really know that they could do something about it. What excites you most about the future of hair restoration?
So I think for a very long time, we're very limited in terms of the drugs that we could use to address hair loss. And we're still kind of in that same framework. There's finasteride, dutasteride, and minoxidil. And that's really the three main drugs that are primarily used and prescribed to patients to address hair loss. But there are advancements. There's new drugs in the pipeline. I'm excited to see some of those drugs developed over the next couple of years. And there's a bunch of in-person procedures that we find to be effective. There's a lot of people doing PRP, which is platelet-rich plasma. This is essentially where we take blood from you, we spin it down, we isolate the growth factors, and we inject that into the scalp. There's also discussions about exosomes, which is very similar to the PRP approach, where you're essentially finding those growth factors on almost on a nanoscale, and again injecting those into the scalp to try to stimulate the stem cells in the hair follicles to grow. So I think over the next 10 to 20 years, I think a lot more focus is going to be on what are the regenerative um, kind of medical applications that can be used to help stimulate hair growth, because not everything is about a hair transplant. And I think there's still a lot we don't know about the physiology of why we lose our hair, and why we're having trouble growing hair, why hair tends to gray over time. We don't have a lot of solutions yet, and I think there's a lot of opportunities to solve a lot of these big issues that really impact everyone, and this is really a global issue because hair loss is everywhere.
Mention related to the medications, this is something that really interested me because I know that you have mentioned in your content with minoxidil that hair can grow in your face. So, do you know if there are any efforts to develop a medicine where that wouldn't happen, or do you think that's impossible?
I don't know of any specific studies focused on developing a drug that's going to perform in a similar way as minoxidil does. Now, when someone uses minoxidil orally, That means you take a pill. What happens is it impacts every follicle on your body. That's not just your scalp. It could be your face. It could be hair around your breast, your groin. So the complication of having what's called unwanted hair growth in areas of your body is really something that impacts women more than men. It's more of a concern for women than for men, because men really don't care about that.
Yeah.
So it's not like you're going to become this furry animal from taking oral minoxidil. But if it's something that does concern you, then my recommendation is to start with topical minoxidil, specifically foam, because I find that the foam is less irritating to the scalp, and that way it's kind of localized in terms of where you're applying the medication. But the issue that I find with topical solutions are you have to apply it on a consistent basis. If you're a female, you don't always want to wash your hair every day, because you do have to wash your hair, about 18 hours after applying the minoxidil. So that can become a nuisance. And the other issue is that hair loss tends to be kind of dispersed and global. So it's not like it's just like in one particular area. For most people, and I'm talking not specifically about women too, women in this case, it could be on the sides, the back, the part. So it could be quite challenging to use a topical solution. I'm not saying that my patients don't use topical solutions, but I'm always in the camp that oral is going to be a lot more effective.
Interesting. I think the progress in this space is incredible. As I mentioned to you, it has evolved a lot, and I think we're at a turning point for hair restoration. It's becoming not just more effective, but also more affordable, and this makes me very excited and happy, as there is a lot to thank to the science and also to the doctors that are dedicating their life to this.
I think a big reason why it's more accessible is first and foremost because there's a lot of dermatology, telehealth sites, specifically companies like Hims, Hers, Roman, that have spent, almost over $1 billion just marketing to consumers about hair loss. And so I think what's happened essentially is there's more awareness than there was before. And so this has kind of accelerated, a lot of both women and male interest in addressing hair loss when they would have never thought to do it before. The other thing to keep in mind is that for a very long time, when people thought about hair loss, they thought about Bosley, which has a male-oriented kind of branding to it. It's associated with older men. Rogaine sounds very male-oriented. It's not a very approachable product. And so you never thought that, if you're in your 20s, your 30s, your 40s, you didn't think these things really applied to you. But I think the approach of a lot of these companies, these telehealth companies, is to make these medications more approachable. And I think that's why the awareness is much stronger than it's ever been. The other area that I would credit awareness in terms of specifically hair transplants to is actually Turkey. Now, I'm not a big fan of young men flying to Turkey to get hair transplants because, in fact, I saw a complication today from a young male patient who had too much hair extracted. And that's one of my biggest fears about people going overseas for medical tourism, that they don't go to the right person. By the way, that's not to say that there aren't amazing hair surgeons in Turkey. There absolutely are, but a vast majority of them are not good. And so Turkey has really spent, there's like, I don't know, there's some crazy stat that says there's close to 1 million hair transplants performed in Turkey every year. So we know that Turkey spent an exorbitant amount of money marketing around the world, making people aware about hair loss. And so this actually has a compounding impact in terms of making people aware of hair loss locally, even if they don't go to Turkey. So all these two things kind of are kind of contributing to the the amount of awareness. But at the same time, this goes back to the beginning of our discussion, which is unfortunately we're still very much limited in terms of our arsenal with the medications that can be used to treat hair loss. And I think that's the biggest unfortunate thing for patients at this stage in the game.
Got it. Got it. How have advancements in regenerative medicine, like stem cell therapy and exosome treatments, impacted the field?
But it's still very early
Very early.
days.
Okay.
There's really not a kind of general consensus, even in the hair community, the dermatologic community, about the safety of using exosomes. And so one of the ways that I lean is if you're thinking about using exosomes, I recommend using autologous exosomes. That means where you're using essentially your own blood and it's getting spun down. It's the same kind of process actually as PRP in terms of isolating the growth factors, the 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 aspects of the exosomes that help stimulate hair growth. There's no consensus yet in terms of is it safe, is it not safe, and even in terms of effectiveness. I don't know if exosomes are any more effective than doing PRP or doing something called mesotherapy, where we inject dutasteride or minoxidil into the scalp. So the consensus for how effective these regenerative um, therapies are, we just don't know yet.
Interesting. Treatments like this. Is this tested after something didn't work out?
What do you mean by testing?
So, for example, why would a doctor recommend stem cell therapy? For
Okay,
yeah.
so when it comes to hair loss, we really want to throw the kitchen sink at your hair, okay? Because the truth is, we don't know which one's going to work and which one's not going to work. Sometimes we like to layer. So I like to layer. That means sometimes I don't try to give everything to the patient for a few reasons. One, that will overwhelm the patient, and
Okay.
two, we don't know which solution's really working. Okay,
Okay.
so how I think about it is like a pyramid. Okay, at the top of the pyramid is oral therapy.
Mm-hmm.
So DHT blockers are always going to be the most effective. Oral minoxidil. Okay, underneath that, I think about in-person procedures. So I think about mesotherapy. Okay, so this is dutasteride or minoxidil. And then I think about PRP and exosomes, and then topical solutions like over-the-counter minoxidil. And then the list goes down and down and down. So back to your original question, when do you start incorporating these regenerative therapies? Well, you can start as soon as you recognize that you're experiencing hair loss. There's no reason to wait.
Yeah.
Okay, so you should be on some oral medication, and then I would say try an in-person procedure therapy. But what's vitally important for everyone to understand is it's not a one-off treatment. It's like getting Botox, actually, and that's the analogy I use. Everyone understands that you get your Botox, it works, and then it wears off after 4 months. It's the same exact thing, whether you're going for mesotherapy, PRP, or exosomes. So the thing that's critically important to understand is that when it comes to hair loss, it's a lifelong commitment. That means you continue these treatments unless you have side effects or you have a medical reason to stop. Other than that, you continue the treatments. Now, what's important for you to understand, Maria, is that not everyone can afford these in-office procedures, and that's okay, because not topical, oral is always going to be the best option. But if they want to do an in-person procedure, they're very effective, and we've seen very good results. And obviously, everyone's going to have varying responses. Some people won't respond. Some people have phenomenal responses. But you got to understand that there's a price associated with getting these procedures, and there's a financial cost associated with that. So it's not within the reach of everyone to be able to have these in-person procedures done.
Understood. Understood. Have you ever had a client where nothing worked out for them?
Hair loss can be quite tricky because it's not just about androgenetic alopecia. Um, you can have an underlying thyroid condition. You can have diabetes. You can have a hair loss condition known as alopecia areata. It's an autoimmune hair loss condition where our own body attacks our hair follicles. You can have a condition known as frontal fibrosing alopecia, which is this is a condition where a woman's hairline tends to recede backwards. It happens after menopause. So there's a lot of different reasons why medical therapy fails, and there's a lot of reasons why hair transplants fail. One of the most important things for anyone is to get a proper diagnosis. It's not just you have hair loss. There's a reason for that hair loss. It's either genetics, it has a medical association with it, or there's an underlying hair loss disease. And that's why it's critically important to go to a clinician who's well trained, who understands how to look at hair follicles under a trichoscopy device. Sometimes you need a biopsy to rule out other certain conditions. So there's a lot of aspects that go into it beyond just you have hair loss.
Very, very important for everybody to know exactly what is happening, because I see a lot of people that they notice their hair is falling and they just go and buy vitamins and they think that that is going to fix it. And sometimes they don't want to go to a dermatologist for X reason, and they don't realize that their condition can advance. And if they don't get treatment at the time that they should, then that is when they're going to have to get a more invasive and expensive treatment like a hair transplant.
And by the way, there's nothing necessarily wrong with addressing vitamin deficiencies. We know that when patients address some of their nutritional issues, that does absolutely help with restimulating new hair growth, preventing hair loss. But there are better tools in the arsenal to kind of stimulate new hair growth faster. That's what's important, and that's why I spend a lot of time actually making content on social media, on YouTube, on TikTok, on Instagram, like on podcasts, because a lot of this is about educating the patient, the consumers, about okay, how do you navigate this kind of what can be kind of a complicated there's a lot of misinformation out there. No one really knows where to start, and so that's why I think it's important to be on the internet and try to educate as many people as possible about what to do with their hair loss.
And I actually learned a lot about hair restoration seeing your content on Instagram, so thank you for that. Do you think that AI or digital technology play a role in diagnosing and planning hair restoration procedures? Or do you think that we're not there yet?
I don't think we're there yet. There are some tools that are used for helping a patient essentially envision what their hair might look like with a certain amount of grafts. But that's not really that realistic, because when you're in surgery, we don't know for sure if we're going to get that many grafts. We don't know if the hair is going to grow. There's a certain level of there's a failure rate in terms of some of the hair is not actually continuing to live. So I don't know how effective those AI tools are from a clinical standpoint. They're more used as a marketing tool. I think where we're going to see AI play a bigger role, and I hope it's in the future, is with robotics. Now, robotics were big in 2013. For some reason, and I don't, we can get into those details, but robotics has kind of taken a trajectory downwards because a lot more of the what's called FUE, follicular unit extraction, where individual hair follicles are removed, are done by manual handpieces, because those handpieces tend to be more effective in terms of extracting grafts at a faster rate and with higher quality. But I do think robotics are going to come back because it's a very tedious process to remove hair from the back of the scalp, especially when you're doing the FUE approach. And I think there's a possibility that the robots in the future will perform the surgery more effectively. But again, we're not there, and I
Mm-hmm.
think it's something to be it's something to wait and see.
Right.
But at the moment, we have great tools to extract hair, and so that's one of the areas I think is kind of missing in the hair world. I think AI is kind of impacting everywhere, every other
Mm-hmm.
sphere of medicine, but it's kind of it's taken a back seat in terms of hair restoration at the moment.
I love the robotics idea. It's mostly something that can save a lot of time and help with the manual work.
There's still a lot of limitations. So we've had robotics for over 10 years,
Mm-hmm.
but there's a lot of limitations with robotics. For instance, it's not really ideal for a female scalp.
Mm.
There's also challenges in terms of how big of a punch is used for the robotic devices, because when we use a handheld piece, we use much smaller punches. A robotic device might have a punch size of 0.95, but on the hand pieces, we use punch sizes that are zero point 0.7. So, in terms of the recovery, in terms of the aesthetics, it's better to have a smaller punch size.
Mm-hmm.
The also An additional issue with the robotics is, okay, can it be used to actually transplant hair to the front? And there is a machine called the artist machine, but even the surgeons who have this new artist AI machine are not really using it
Oh,
for transplanting hair to the front. It's clunky. It's not
wow.
really
Okay.
it's not a kind of a seamless process. And so I think we will see advancements in robotics and AI in the future, but it's something that's kind of taken a massive backseat a massive backseat at the moment.
Do you think that the non-surgical solutions are catching up to surgical transplants in terms of effectiveness?
Is that the entry point to hair transplants is through medical therapy. Again, this goes back to what's happened in Turkey, what's happened with these telehealth companies, the exorbitant amount of money that's been spent to educate people about hair loss. So we're seeing more and more patients, on these medications, and that's absolutely the place you want to start
Mm-hmm.
if you have hair loss. You do not want to go for a hair transplant without being on some form of medical therapy. And so as more and more people continue to take medication, they discover, hey, you know what? I'm not completely satisfied. I want more coverage. I want more density, and that's kind of the next step, which is a hair transplant.
Very exciting to see all of these options emerging. For the people who might not be ready for a surgery, but they still want to see real and lasting change in their hair.
Yeah, absolutely. So, I mean, I think that the place to start again is always with medical therapy, and it starts with education. So, like this podcast is a great place to start to understand, like, what is hair restoration all about? What is hair loss about? What are kind of the steps for me to eventually potentially have a hair transplant?
What are the biggest challenges that patients face when seeking hair restoration treatments?
Finding the right surgeon, I think that's a big challenge, and figuring
Mm-hmm.
out who is qualified to do the surgery. Just because you have a shingle on your door that says you perform hair restoration does not necessarily mean you're the most competent person to go to.
Mm-hmm.
You need to go to someone who has done hundreds, if not thousands, of hair transplants, that has the education and the background to understand how to diagnose hair loss correctly. Because the last thing you want to do is have a hair transplant and then have a failed result
Yeah.
because the medical condition was not properly diagnosed. So I think the challenge is now, we live in a world where we're inundated by social media.
Mm-hmm.
And what you really have to do is you have to kind of navigate that and say, okay, that's wonderful, but are you qualified? Are you a great surgeon? What do your results look like? What are what are the reviews about your bedside manner, your performance, the results? So yeah, there's a lot that goes into kind of finding the right surgeon, and I think that's the biggest challenge.
Yeah. Yeah, that makes a lot of sense. I do think there is a lot of information out there, and I can see how it can be a little overwhelming for people to try to figure out the best option. Do you have any tips on how to find the right surgeon?
So I think there's a variety of things you have to do. First and foremost, just read up on the surgeon, read information on their website, read their Google reviews.
Mm-hmm.
If you can get a consultation with the doctor, that would be a great first step. And then if you're kind of on the fence about a particular surgeon, my recommendation is see if they have any patients that would be willing to speak to you firsthand,
Right.
because that's where you'll really get the insight.
Mm-hmm.
If patients who've gone through the experience of working with a surgeon, do they like the results? What was their bedside manner? What was the follow up like? That's all those things are good.
That's a great tip. What has been your biggest challenge in growing your practice?
There's not been many challenges in growing the practice because the interest in hair loss is immense and it's almost endless. I'm excited just about the possibility of continuing to educate more and more
Mm-hmm.
people about hair loss, because sometimes they just don't realize there's a solution. And
Yeah.
I find it rewarding when I'm able to help someone uh, address an issue that they didn't think could be addressed, or they weren't even thinking about it.
Mm-hmm.
So there really hasn't been a challenge because there's a huge need
Okay.
for great hair loss experts, and hair surgeons to address this huge kind of untapped area of cosmetics.
Interesting. So the biggest barrier would be educating people. Also, I think if they already consume your content, they have already a little bit better of an idea before they have a consultation with.
I think that one of the most wonderful things is that the patients that come in today to any office, any physician's office, come a lot more educated
Yes.
because they spend a lot of time watching videos on the internet and reading, and they use AI platforms. So
Hmm.
they come in ready to have like these in-depth conversations. So that's an amazing thing because you want the patient to be actively involved in their
Yeah.
care, and that also makes the physician perform at a higher level.
Okay, so we know that there is a lot of interest in the industry, but do you think there is any barrier for you to get high ticket clients?
Yeah, so obviously there's a price difference between being treated medically and going
Yeah.
for a surgical procedure. If you're interested in a hair transplant and you've done your research, you kind of know what the price is. You know what it's going to cost. So I find that the patients that are well educated about the procedure are not surprised when they hear what's
Nice.
the
Hmm.
what's the financial cost of having the surgery. So again, I think this all goes back to the importance of educating kind of the consumer or the
Hmm.
patient about what this whole process is about, and if they're involved in kind of consuming that information before they arrive for a consultation, it's a much easier kind of conversion
Uh-huh.
for these hair transplant patients to have surgery.
So it is very clear that trust and education play the biggest role for someone to do a procedure like this.
Yes, absolutely.
Have you seen any change in the marketing side of the hair restoration industry over the years? Apart from the education, anything else?
I think it's just become more aggressive
Okay.
because there's more and more hair surgeons, more and more dermatologists involved in hair loss every single year. And
Hmm.
so there's an aggressiveness in terms of being present on the internet, and the level of marketing that's required. And that's just what happens when there's competition.
Yeah,
That
totally.
everyone is kind of navigates to the platforms where they think they can maximize the number of patients that they can get into their practice. But I do want to emphasize something. My goal is not to bring in 1,000 patients.
Hmm.
At our practice, we pride ourselves on being what we call a boutique practice because we really follow our patients very, very closely. So I hand out my cell phone number after surgery, and patients can text me and call me any hour of the day for the next 3 weeks after surgery.
Mm-hmm.
So I couldn't do that if I had 1,000 or 2,000 patients.
Yeah.
So the goal is not to get every single person who has hair loss. It's really to kind of to tap into the patients who want the highest level of care. And I'm happy to send patients to other colleagues of mine, just because of the capacity. There's only a finite amount of patients that I can actually take care of in a yearly basis.
Very fascinating to see how things have shifted because the way that people make decisions today is very different than 5 years or 10 years ago, and the marketing strategies have evolved with that. And it's also very great to hear that you are not saying yes to everybody, so that way you can give them the right experience and the right results.
Yes, absolutely. I mean, I think that's, and it's important to turn patients away too.
Yes.
You don't want to take every single patient, because not every patient is a good patient, a good candidate, and that's something that you learn as you practice medicine. That you have to kind of be very diligent about who the surgery is for and who it is not for.
You ever had a client where they have gotten mad with you because you didn't take them in?
I set realistic expectations.
Okay.
Patients might want to come in and they want something done and they want this or that. If I don't feel like it's safe, it's not within my means, I do not proceed with that patient. Yeah.
For your practice, are referrals still the best source to get clients, or do you think that education and online strategies have taken over?
The best source of new patients is investing in your current patients, okay? Because your current patients will become your referral source. It's not a referral source from other doctors. It's a referral source from your own patients, and that's the group that needs to be you need to be the most invested in. And at the end of the day, that's how you deliver quality. Because if you deliver really good care to the patients you're taking care of, they will be your advocates for future patients that come into your office.
Yeah. Yes, word of mouth is probably the most powerful factor in this industry. Have you seen a shift in the demographics of the people seeking hair restoration? And if so, what do you think is driving the change?
I think patients from all backgrounds, um, ethnicities are thinking about hair transplants. Whether you're Black, Asian, Hispanic, Caucasian, it doesn't matter. Hair loss impacts everyone in different ways, different reasons why they're experiencing hair loss. If anything, I'm just seeing more and more interest in hair restoration, whether it's from a medical standpoint or from a surgical standpoint. And it's not one particular group over another particular group.
How has social media influenced patient demand and expectations?
As I kind of highlighted earlier, I think that unfortunately social media helps to set unrealistic expectations for what can be achieved, because not everyone, for instance, goes to Turkey and has a great result, but yet there are some great YouTube videos on patients who went to Turkish clinics and they had a great experience. There's plenty of videos out there of patients who went to Turkey and had horrible results. So I think, again, you have to be very critical about the source you're looking at when you get your information. I also think sometimes relying on other patients' experiences is critically important. That's why a lot of people like to go to Reddit, because they can get kind of real insight into what their recovery process was. There's no fluff there. They don't have an incentive to have fluff, because these are patients sharing their own patient experiences. And so I would say, use these other social media platforms in a way that you still have a very critical eye, and I think that way you'll end up kind of figuring out who is the most reputable person for you to go for a hair transplant.
When you say bad results, what have you seen? It's that is it mostly that it doesn't look good, or are there any health issues involved?
One of the biggest issues with young people having hair transplants is that they want this kind of transformation, especially if they have a significant amount of hair loss,
Hmm.
and they might be, let's if we're talking about male patients, they want to look youthful, they're dating, but the challenge is that you have a finite amount of hair in the back of your scalp,
Hmm.
and so you have to be very, very careful. Complications that I've seen are too much hair was taken from the back of the scalp, which causes what's called a see-through issue. You can see right back, you can see the scalp essentially, and that's
Hmm.
not what you want to accomplish. That's one of the biggest issues. And then the other issue that I've seen is the hairline was lowered too low in a young male.
Oh
Well,
no.
because hair loss is progressive and it kind of goes backwards as we age, lowering a hairline in a young male makes no sense because you can end up having an island of hair and then hair loss behind it. And because there's a finite
Right.
amount of hair on the back of the scalp, well, that's a major complication.
And there's once that happens, there's nothing to do to fix it, right?
I don't want to say that
Okay.
there's nothing to do, but they're complicated cases in terms of what needs to be done. Sometimes, if you have a beard in a male patient, we can take hair from underneath the chin and we can use that to help kind of camouflage some of those areas. Sometimes we take hair from the sides of the scalp
Hmm.
if the donor hair looks like it's safe to take. But again, these are complications that we have to be very cautious about treating, especially in young men.
What has been your biggest challenge with a patient?
The biggest challenge is just making sure we have the right patients.
Mm.
We turn away patients who we don't think are good candidates, and I think we want to do really good work, and we don't want to overpromise. We want to underpromise and overdeliver.
All right. Well, where can listeners learn more about your work or get in touch with you?
So I'm active on Instagram, Dr. Ross, Doctor spelled out. I'm also on TikTok, Dr. Ross Kopelman, and I have a very active YouTube channel, Dr. Kopelman. And yeah, you can DM me. I respond to almost everyone who reaches out to me. And if you're interested in any hair restoration, check out Kopelman Hair Restoration on Google, and our website should pop up.
Amazing. I'll add all of that in the show notes. Um, Two more questions. If you can remove one major headache from the marketing side of your business, what would it be?
If I didn't have to make content on a routine basis to keep up with the exorbitant amount of other content that's created on the internet, that would be great. I would love that.
Yeah, I'm
Um,
sure that takes a lot of time from you,
yeah,
from one
content
side.
creation takes a tremendous amount of time. It's almost like another full time job.
Yeah, 100%. All right, well, that's great to know. Thank you so much, Dr. Kopperman. This was a great, great conversation. I really appreciate you taking the time to share your knowledge. It's been very insightful for me. Thank you for giving me the opportunity. Apart from this, I do want to let you know that